Today I'm going to talk about making safe and effective plastic surgery decisions. I've talked about this before in a previous video or in several videos. I wanted to sort of consolidate these ideas as well as present new ones. So first of all, a few things that I want to present is a big picture thinking. It's very important that we think about what I call the blink effect, written by Malcolm Gladwell, which is the idea that why do plastic surgery? A lot of times we start getting in really, really tight little corners and could he fix this? Could he fix this? Could that little area, could I fix this? And it's oftentimes the reason for that is that women in particular put makeup on, they get very close to the mirror and they see all the little flaws that are there. And so it's very important when I try to give you a big picture, you'll see during consultation, I'll come up close to you for a few seconds. But oftentimes, the way that I make my judgment is in a blink of an eye at 3 feet away when I see you. And what's so important about the blink effect is I would like when someone sees you after the procedures, God, you look great. I don't know what it is. You look rested. You look wonderful. I don't know what it is about you. You look great. Everything looks fantastic. Versus, are you still tired? Are you angry at me? Those comments that we oftentimes get when we miss the picture, when I don't make the eyes rejuvenated, when I don't make the face look rested. And there's these little places that I fix, but overall you still don't look good. So I always try to help you see the big picture, and that's what I call the blink effect, or the girlfriend test, which means if you have lunch with your girlfriend or boyfriend, whatever, and you look at that person across the way from you, you've already made a choice of whether that person looks good, bad, indifferent, whatever it is, in immediate second, really very, very quickly. So what I want to do is have you understand what my goal for you is to look better immediately when someone sees you walking through the door, not when you're taking makeup off at 8:30 at night, close to the mirror with magnifying lens, looking at different angles at 3 inches. So the blink effect is so important, number one. Along those lines, then, priorities. So when you come for a consultation, what I'll do is give you priorities, because oftentimes, remember, let's say, for example, you are a shoe salesperson. You sell shoes, and all you know is shoes. And I tell you, I'm the shoe salesman. I'll say, you know what? Don't buy that shoe. It's going to hurt. You go, no, I want to buy that shoe because it's beautiful. And sure enough, 4 days later, your shoe starts to hurt your feet. The reason for that is the shoe salesperson, all they do is think about shoes day in, day out. So what I want to address with you is understanding that what I do, all I do day in, day out is the face. So what I want to do is give you priorities. And so at the end of a consultation, you'll hear, if you had to do one thing, this would be it. If I had to do 2 things for you, this would be it. If I had to do 3 things for you, this would be it. And I give you those priorities to help guide you. You don't have to follow those. You certainly can pick and choose whatever bothers you. But if I don't give you priorities that I see, so sort of educational oversight to say, look, here are the things that I would really, really like to do for you because it'll make a bigger impact for you, and don't waste your money on this, then you at least get my 2 cents of where I see things. Again, it doesn't mean you have to follow what I say. It just means that, look, these are things that you may not even thought about. For example, like Botox, people think, well, that's a waste of money. It's only for short-term gains. And I try to educate patients to understand that over a period of 1 or 2 years of consistent Botox, I clean up all the wrinkles and I heal your skin. I didn't know Botox heals the skin. Well, probably you didn't know that because you were not in this field. You don't think about those kind of things, whereas I do, and my goal is to educate you. So giving you priorities helps you make those decisions. The other thing I like to emphasize is budget. So a lot of people say, I could afford all these things, but I think I'm just going to do these 2 items and not the 3rd item. And I would say, and then I see on my priority list, okay, 1, 2, 3, 4 things you could do, but 4 is really probably a waste of money. If you had unlimited disposable income and may give you a 15% margin, maybe we'll do it. This one really is going to probably be dangerous. Let's not do this. For you in particular, this one is going to be effective, but not so effective. And this one really is important. I really like for you to do it if you could afford to do it. An example is, let's say you have a lot of aging and your face has aging and your hands really look aged, and you decide not to do it because you just don't want to do it. I said, that's fine, you don't have to do it. But if you understand what I can do for you and you have the budget for it, really consider to do it. Because a lot of people say, well, I'll just do it next year. If you have the budget, the people that regret it are the ones that don't do it at the same time. Those that can't afford it, I discourage them from doing it because I don't want you to mortgage your house to do something you can't afford. But if you can't afford it, no one wants to go through 2 recovery periods. No one wants to wait a year to look better. People want to get immediate results and see those things. An example is, I'll do 2 examples. An Asian female that came in and she really needed a chin implant with a rhinoplasty. So I said, I really would, let me image you, let me show you what a chin implant can do. She says, well, I don't know if I want to do it. I said, well, don't do it if you don't want to do it, but I want to show you this improvement. She said, I can see the improvement. I said, can you afford it? She says, yeah, I can afford it. I can easily afford it? Yes. So right after I did the nose, she goes, oh, I should have done the chin. And there's regret. I know there's regret when someone can afford something and they don't do it. Another example is a 74-year-old lady that I did. I did her fat transfer, I did her neck lift, and I encouraged her highly to do her hands. I said, could you afford this? She says, yeah, I can afford the hands. And sure enough, the next day she goes, oh, I'm in love with everything you've done. It's amazing, but I wish I had done my hands. So just remember, if you can afford it, and if I do recommend it as on a high priority list, really consider adding it. You don't have to do it. Everything has risk-benefit ratios, costs that you could have spent on something else. But if I recommend it and you can't afford it, consider doing it. Which brings me to the last point, which I touched upon, which is, when should you do these things? Well, I've had people come to me and say, I'm 47 years old. I will do everything when I'm 50. You know, I'm 50 years old. I'll do everything when I'm 60. I always say, why? Why do you want to look better now, or do you want to look better in 3 to 5 years from now? What is this magical date that you want to look better? I think part of what it is that maybe your mother went through a huge facelift with a month recovery and you had to take time off from work. I can do a full neck lift without even an incision now with this kind of trampoline lift and small things. So we got to get away from, one is that we have to do big things. We can do Botox, fillers, we can do small little things that we don't have to do big things. Or if it's within your budget and you can do slightly something bigger, I can do a lot of things with not even an incision. But I think part of it is we have this mental idea that we're not old until we're blank, you know? The joke is that someone's old if they're older than you, and someone's young if they're younger than you. But the point of this is that, you know, why defer doing something until you're a certain age? I had a lady that I met in Barcelona in her early 50s. She says, well, when I'm 55 or so, I'm going to do something. And then she wrote me an email recently and says, you know, that stuck in my mind when you said, why do you want to wait? Do you want to look better now, or do you want to look better in 4 years from now? Another story is a lady that was saving money to get the biggest procedure. She saved until she was 78 years old. Finally came in all this money, booked everything, scheduled everything with me, and then she was diagnosed with cancer. So once she was diagnosed with cancer, obviously I refunded everything. She couldn't do anything. And I don't know if she passed on, but this is a huge thing, is when you have the opportunity to look better, enjoy the time now. So hopefully this video about priorities, about understanding blink effects, understanding budget and desires, and understanding timing are good ways to structure your thinking as you approach cosmetic facial surgery.